computer is picking up a strange signal. Here, sir, you better take a look at
it. Hello dear listener, and welcome to episode 87 of Life Through a Prism with your host Rob Tierney. Today we're going to look at an article from the website disabilitysupportguide.com.au entitled Older Australians with Disability Missing Out on Key Health Supports, New Survey Finds. Older Australians with disability or complex needs are falling behind in health outcomes, despite Australia ranking near the top internationally for primary care quality, according to the latest OECD Paris 2025 report. While the report shows Australia performing strongly overall in patient-centred care and coordination, the data also reveal a troubling gap for those with chronic and complex conditions, many of whom rely on disability supports or NDIS-funded services. The survey shows just how much the quality of healthcare depends on who you are and where you live, says the OECD Paris Australian National Report 2025. People with lower education or income who live in regional areas or have 3 or more chronic conditions reported the worst outcomes. Australia's primary care, high ranking, mixed reality. The OECD Patient-Reported Indicator Surveys, Paris, measure health outcomes and care experiences for people aged 45 and over with chronic conditions. In the 2025 National Report, 94% of Australians surveyed rated their care quality as positive, well above the OECD average of 87%. 74% reported good coordination of care versus 59% across the OECD. Australia ranking 3rd for coordination and 4th for person-centred care among 19 participating countries. But for Australians with disability, mental illness or multiple chronic conditions, outcomes were consistently worse. Complex needs, poor outcomes. People with 3 or more chronic conditions reported lower levels of trust in their providers, reduced confidence in managing their own health, significantly poorer health and well-being outcomes. People with mental health, neurological or liver conditions frequently linked to disability also scored lower across nearly all experience and outcome measures. You can have great GPs and still not meet the needs of someone with complex disability, says the report. The system is not yet delivering consistently integrated care for people with multiple long-term conditions. Who's missing out? The people most at risk of poor outcomes included those who lived in regional or remote areas, had lower education or income, were under 65 and living with complex illness or disability. According to the report, 18% of respondents skipped care due to access issues. 17% cut back on medications due to cost. 11% struggled to pay health-related bills. We talk a lot about choice and control in the NDIS, a consumer advocate is quoted as saying in the report. But how can people choose quality care when they can't afford to get there or don't know what's available? Mental health still a gap. Despite Australia's strengths in physical health care, the country ranked 11th for mental health outcomes, 12th for social functioning, and 13th for well-being among the 19 countries. These figures are especially concerning for people with psychosocial disability who frequently rely on NDIS supports and face barriers to mental health care integration. Digital divide widens health gaps. The survey also revealed a gap in digital health access. 60% of GP practices offer telehealth, but just 40% of patients knew it was available. Only 8% could access medical records online, and just 22% used digital services to request repeat prescriptions. Digital access isn't a luxury, the report warns. For some people with disability, it's the only way to manage their health safely and independently. What needs to change? The report calls for better support for people with complex needs, particularly continuity of care through stable GP relationships, stronger integration between NDIS supports and primary care, clear communication and planning tools, for example shared care plans, accessible and inclusive digital services that don't leave anyone behind. There you go, listener. It's not a good read. What do you think? Do you feel you belong somewhere in there? Would love to hear what you have to say. Let's have a conversation. I know from my experience as someone that falls into this area, it's really hard to keep the minimal services that one has with being denied twice the NDIS. There is not the stability in knowing that you will have a service. I have had a few experiences where service providers were no longer either going to be able to help under 65s or go out of business without telling clients, then being left to be broken like some cattle in a sale yard. And then when you're treated like you do not have a life and you should be just grateful for a service and not complain when times change on a consistent basis, not knowing if you can make appointments without a service to change the time, even the night before. There is one thing these organisations forget. Without us, they would not exist. Before I finish today's episode, I would just like to ask if you have enjoyed this podcast and enjoy the free content I create, could you please give a like and consider subscribing? The podcast is not only on Spotify, but Apple and YouTube as well. In regards to YouTube, they have changed the algorithm that if there is not listener engagement, for example, a like or subscribe, the podcast is less likely to turn up in searches. I'm not asking you to do that, but if you do like the podcast, I would appreciate any help to get the podcast out there. Also, now the podcast has a webpage, and the links to all these will be in the show notes. I enjoy creating this content for you, and it helps me be motivated to continue to make great content in the future. Till next time, take care, and bye for now.